Hello, uh, welcome to the Department of Psychiatry and Behavioral Sciences Grand Round Series. My name is Joe Saramelli and I oversee Grand Rounds for our department. So I want to just mention a few things about today's presentation, about the Grand Round Series in general, and then I'll turn it over to Jürgen for today's introduction. First, during the presentation, there's the comment area and there's the Q&A. Both are fine places to write in comments or questions. I can go through those at the end with the presenter after, we'll have time at the end for questions. There is a group of us that work on Grand Rounds, including Samhar Braha and Mike Walker. We do record and archive our presentations on the department website under the Grand Round section. And there's two sources of funding for this year's Grand Round Series, the Ripley Fund and the Garvey Institute for Brain Health Solutions. Close to the end of the presentation, I'll put a link in the chat that has a couple of questions for a Grand Round evaluation. That's helpful for me for planning. And with that, I'll turn it over, just turn it right over to Jürgen for today's introduction.
All right, well, good afternoon, everybody. Welcome to Grand Rounds today. It's my real pleasure today to introduce our Grand Round speaker for today, Tom Soprano. Tom is one of our own. He's one of our graduates. He's now one of our faculty. He is a fabulous teaching scholar, a great clinician, a great teacher, and a real teaching scholar. I think Tom is one of the most creative and dedicated and effective teachers I've had the pleasure of meeting. He continues to innovate. He did something very smart and sophisticated, very simple, but sometimes simple is the best when he developed, I think, what you call a layered teaching model, right, Tom? And maybe someday he'll tell you about that if you haven't heard about it yet. Tom's a consultation liaison psychiatrist. He does transplant psychiatry. He is now our new director of our CL Psychiatry Fellowship. He's also active nationally at the state level. He's our current Washington State Psychiatric Association president and represents us really beautifully in that context. And with that work, I think he's really helping shape our profession, our field, how we work as psychiatrists. And I hope he's going to share with us some of what he does in that context, talking about education, about advocacy, about opportunities for us in the field of psychiatry. So with that, I will turn it over to Tom. Welcome and thank you for doing this Grand Rounds today, Tom.
Thanks, Jürgen. That's very gracious of you, and thank you, Joe, for the invitation. Like Jürgen said, I'm lucky to be leading the Washington State Psychiatric Association, or WSPA, and I have to be upfront with you about that position. I came to be in that position unintentionally. I suspect, like many of you guys, politics and government and legislation and advocacy are like not my thing. They're scary words to me. I probably went to medical school to avoid things and realms that I'm not proficient in, like these, and I'm frankly pretty ignorant about them. So I come to you from a very humble stance, and I hope that in many ways decreases the barrier of entry for all of you guys, seeing a pretty horrific example of somebody kind of diving into things ignorantly. And I actually have Jürgen, I'll say, to blame for my position. Jürgen, word on the street was that Dorcas came to me as a past president from WSPA upon a recommendation from Jürgen, so I have him to thank for that. And I have this general philosophy of just saying yes to almost anything if I haven't tried it before, because you never really know what you'll actually like until you really try it out. So when Dorcas approached me, I again naively said yes, and I began a kind of 3-year journey to becoming the president of WSPA. And I was like, 100% unprepared, 100% unaware of what I'd even be doing, really idealistic like I always am. And, truth is, I entered this process pretty unhopeful. I felt like outnumbered and under-resourced when it came to the whole world of politics. And, I'll talk about some of that journey. So I'll start to share my screen here. Oh, and another disclosure, those of you trainees or other people who have worked with me before know that I almost never create PowerPoint. So I apologize in advance for all of this stuff and slides and things that I don't know how to create proficiently. This is not the type of teacher that I am. So with that, I'll move forward. Disclaimer, we will be talking about some people would call them like some hot topics, especially in the realm of, government and legal proceedings. And, I want to focus us in mostly on the process, but I'm going to use some of these examples to illustrate some of the concepts. But I want to try to stay away from like getting into a debate about what is good and bad. That being said, I'm a somewhat provocative person, so I'm going to bring in some of that and hear what all you guys have to say about that. Also, get out your cell phones because I'm going to have some audience response things because I can't teach without having you guys involved. And coming back to process, the real focus of all of this whole talk comes down to like getting people involved, because even if we were going to debate about the subjects, the truth is the most important thing is that we're all participating and having a voice. So the other part of the disclaimer is, I'm not making any money in this process and I'm no expert. Okay, so here's what I plan to do. We're going to talk about like what's going on in Washington State. And then we're going to use some examples. And then lastly, I'm going to try to leave you with some concrete steps forward. Beginning here, I'd like you guys to hop in to Pull Everywhere. So you can do this on your computer, or if you're on your phone, or both. And you just text to this number. So this number at the top, and then you text this and it'll like light it up, and then we'll see what happens here. So 2 barriers to you being involved in advocacy, and there are like a million, right? Yeah, me too, right? Like, so nobody here has enough time, that's for sure. How do we do this? We don't get an education in this in our medical schools or in residency a lot. There are some noon meetings about that. Yeah, does it fit with our schedule? I don't know enough about it. Feeling overwhelmed. Oh my goodness, yes. Being an expert, right? We as physicians get a little bit maybe too used to being experts in these realms, and it's uncomfortable when we're not, for sure. Feeling insufficient, a lot of discomfort here, being busy, not knowing enough, unclear as to what to do. Awesome. Yeah, but you see these word clouds form by frequency, so everybody's saying time and ignorance, right? And let's talk a little bit about that. All right, thank you for humoring me. All right, so the landscape of what it looks like in Washington State. So we are ranking 32 out of the 50 states for a lot of reasons, a lot of which are here. Had I have more time, I'd go into the details of this a little bit more, but I just want to give big picture view as to why that is a little bit. It seems like when we go through the smaller details about this, I'll have some clear reasons for that. So it's important to know that our 32nd ranking we're going down. Last year we were in 31st place, so that's not a fantastic trend either, but it's not all our fault. One of the biggest reasons is prevalence. So prevalence of mental illness in Washington State is really, really high. It's really only Colorado, Nevada, Utah, Wyoming, Alaska, Vermont, and Oregon that have higher prevalences than we do. Not something that we can necessarily do a ton about, although, prevention is the key, right? I'll leave that to somebody else. Adult prevalence contributes to that, so 47% there. And then also in our youth, Again, super high prevalence, so in both populations, and then not to mention substance use disorders. So all throughout, we have high prevalences, which I think is the biggest contributor to some of our challenges in ranking. And maybe ranking doesn't matter a ton, but I think taking a step back and using those numbers can be useful. Another realm more nationally, so this is national data, we're doing pretty bad when it comes to diversity, equity, inclusion, and mental health treatment. So you'll see white youth are treated at 22%, which is horrible in of itself, but it's even worse when you look at BIPOC, and then especially in our Asian youth. And the Seattle area specifically has a high proportion of Asian population. So really a lot of growth to be had there. So now that I've probably thoroughly depressed you and hopefully shown you what we're up against, I'd like to start thinking about some factors that play a role. So one of my 4 brothers lives in New York, and I'm a touch competitive with him, and we're kind of constantly goading each other about who lives in a better place. And he works at NYU, I work at UW, and he's a dentist, and he has a very equivalent role to me as an associate program director there in dentistry. And so, we're constantly kind of talking and comparing, and that's really helpful. And I'm often complaining to him about how parity and bias play a really big role in what we do as psychiatrists. And those of you who've worked with me know that, like, clinically, worked with me clinically, like, I like to Google image things. So on this slide, you'll see a screenshot of me simply Google imaging the word dentist, right? And I hope we can all acknowledge the number of smiles going on here, and my only explanation is maybe nitrous, which gives them a leg up. But this is really not my experience of the dentist. And I'd like you to just contrast this and imagine how it might look if we Google imaged psychiatrist, right? This is a study of 2,000 Dutch adults, and it demonstrates how ubiquitous fear and phobia of dentists is. Dentists may be the only profession that's more loathed than psychiatry. So coming back to, like, my conversation with my brother, so I'm complaining about parity, and my point in bringing this up is one would think that dentists would struggle with some of the same issues given the negative associations that many individuals have with dentistry. But the story I get from my brothers, they are not struggling with reimbursement. They don't struggle with parity. They don't struggle with the same issues that we do. And obviously, this is not an apples to apples comparison, but stick with me for a second here. I'd like to postulate that dentists have been much more successful at advocating for themselves. They have been able to curtail the image of dentistry, even contrary to how people think about them, and curtail it to a way that it aligns with the images we see on the Google image search, right, of dentists. And they've ensured through the legislative process that they're fairly compensated, and that they have power and control and leverage in the legislature. On the other hand, physicians, you can see here the AMA rate of involvement. Physicians are really poorly involved in national organizations, and as a result, we have much less power and influence in what happens. And it's not just influence over our profession and the realms that we influence there, but also our patients, and it has an effect on them. And I think that's something we can all get behind. We went into medicine to help people, but none of us anticipated that, like, after 30 years of education, that, like, we would be the bad guys. This quote at the top of that slide is like, I've never met a poor doctor. This was the example our WSPA lobbyists used in explaining to me, like, my total and correcting my total misperception of how doctors were seen in politics. I really naively thought that, like, we're the good guys. We're trying to help people, and that we could just go up to Capitol Hill and be like, hey, we really want to treat mental illness and reverse, this huge prevalence issue in our state, and they'd, like, graciously hand us all the resources we need. And obviously that's not really happening. But I was educated that a lot of this happens because the typical politician sees us as practitioners as people who are mostly in it for ourselves, treating, cash paying only, worried well in our like high-rise luxury condos or offices, overlooking the Puget Sound and sipping champagne, right? And I know this is not reality, but if dentists can take people's real and prominent fears and like turn them into these smiles and fair compensation, I'd like to postulate that maybe we can too. All right, so back to process. So when others find out that like I'm the WSPA president, which is always like a discomfort for me, they're invariably interested in sharing an idea they have and fixing a problem, which is awesome. I think all of us are a bit of idealists going into medicine. We really want to help people, and we see how things get in our way, and we can easily think of creative solutions to fix those things. But the issue is it's really hard to take an idea and move it all the way into actually having impact on our patients. Lots of time and money and effort. There are a lot of people who know the amount of involvement and the amount of money we have. We are not able to practice in a more proactive way. We're more in the process of stopping bad ideas from happening. I would like to imagine a future where we do have all the resources we need, and we can ourselves as an organization promote and like fix problems. But right now we're really mostly trying to stop bad ideas. So our lovely lobbyist talks about the process of killing bills. So that's how we tend to function in our organization. And I know that a lot of medical organizations function this way. We're trying to, block additional loopholes and minimize any uncompensated mandates and defend against more and further systemic disparities that are happening. And really, I think unintentionally being unconsciously baked into the law and the system. So that's kind of the approach we have to take as a result of the reality of the organization and the amount of power we have. So this quote here kind of succinctly summarizes what I've been trying to describe. So now we're going to shift gears here toward some examples and so forth. This is a quick, and quite blurry, I apologize, view of the APA's mission. So, Washington State Psychiatric Association is a district branch of the more broad APA. These are their strategic priorities. So advancing like our profession and supporting research and education and diversity, which I think kind of covers everything from a professional standpoint. So real quick, another poll. Please let me know what are the changes that you guys would like to see to either help in the work that we do or help with patients or challenges that you're constantly coming up against and you're like, I have an idea, because speaking of the ideas, I'd like to hear what you guys think. Sorry, I got to pull up that and activate. I apologize. There you go. What changes do you guys want to see? Yes, universal healthcare. Access. Yep, huge issues. Supportive housing. God, I've had so many patients who get better immediately after housing. It's incredible. Access, documentation. Documentation's a bad word in our profession. Parity for sure. Yep. Yeah. It's so hard. I try to encourage so many patients to get therapy because it's just so effective and helpful, especially in a transplant setting. And I always kind of also, cringe a little bit as I recommend it, knowing how hard it is to find a therapist. Step downs, access to housing. Yeah. Okay, let's shift gears back again. Thank you, guys. So some examples here, both hopefully highlighting the risks and the benefits of our involvement or lack thereof. So in the United States, we have the benefit of having a very clear roadmap. We're somewhat lucky in Washington. We're not usually like at the very forefront in terms of like states or at the very bottom or end of any kind of political movement. So we can leverage this by this knowledge by learning from the states that come before or after us, and we'll have a few examples of this. So I'm going to use these maps as kind of like a literal and figurative map of like where things are going and what we can learn. It'd be great if we could avoid the mistakes of some of our neighboring states and replicating the successes. So you'll remember those past slides about the overwhelming prevalence of mental illness. Here's a more rosy picture of what has been happening across our country. This is a map of access to care legislation across the country, and a lot of you guys just mentioned access. So red represents our prior authorization system. Raise your hand if you hate prior auths, right? Green is the 988 implementation, which was a bill in legislation this year. And looking like it's going to pass. And then purple represents the telehealth legislation. And then lastly, blue is collaborative care, which, our leadership at UW has really been, leaders in. So all in all, our access to care legislation is really super solid, thanks largely in part to the innovation and leadership from all of you guys across the state. For like more than a decade, these efforts have been going on. These changes do happen, and so this is a very a bright spot and a good example of how especially our state has been effective in increasing access to care. And this is not to mention, I didn't want, there's too much to cover, honestly, not to mention the PCL line, which has been a huge success and provided access to mental health care to rural communities all throughout the state, who would otherwise have basically no access to mental health treatment. So this manifests really concretely. So here in access to care, we're ranking number 11. So other factors that play into this is workforce availability. Over the course of the last 4 years, our residency, I'm part of the residency leadership. Our residency at the University of Washington has been able to add 4 additional residency spots for 4 consecutive years. That's the size of most residency programs. So this is a huge contribution to the overall goal of training more psychiatrists to meet the growing needs. And this was all, again, facilitated through the legislative process. In addition, it's worth mentioning that we added a Montana track, so, combining efforts with other states. And then our Boise track in Idaho also was able to now fly solo. So they have their own program, which again, contributes to recruitment of psychiatrists in those realms. And it's also worth mentioning in the past we had Spokane, the Spokane track, which is doing really well. So our program's been really successful in getting rural communities training programs. And we know that when you train people in a rural setting, you're preparing them for that practice, and that's the most likely way to keep them in those regions as well. There's a lot of research behind that. So this is a really important principle for access to care, and it's also important in the realm of diversity, equity, and inclusion, where if people are able to, from a patient perspective and a practitioner perspective, see people like themselves working and getting care in those settings, we can totally we can provide more equitable care. Sorry, I should have figured out how to turn off my Outlook alerts. They're like constantly popping up. So anyways, so number 11 in workforce availability. as with every professional organization, there are common, like what people call turf battles. I don't like really to call them that because I also want to avoid a discussion about this specific subject, whether it's like right or wrong in this scenario. I think we can all agree that there's like plenty of work for everyone. My point in showing this slide is that the complexity of mental health care is destined to increase. The public has really never been able to figure out the difference between psychiatrists and psychologists, and also for all the psychologists here, it's, you guys play a key role, and I don't mean to exclude really any people in this talk. I only have experience with the WSPA, and I know that this could create some tension, but hopefully I'm speaking mostly to the fact that I want people to be involved in the conversation more than anything. But the point of this slide is that, this is a map of the legislation of expanding both nurse practitioners, PAs, both, and pharmacists' capacity to prescribe medications across the country. And in the most optimistic vantage points for this is great. This could increase access to care. I think it also plays a risk in if our practitioners in these realms don't get appropriate training. I always have an eye towards education. It could actually set the realm of mental health care back if patients have bad experiences or poor outcomes. So my greatest concern in regards to scope expansion is the issue of appropriate education for practice and regulation of that practice and the risk of escalating the stigma. As a CL psychiatrist, I'm often the first psychiatrist a patient has ever seen. And in many ways, that patient will potentially forever be influenced and primed based on our interaction. And I take this as a very serious matter. Mental health bias alone is such a huge deterrent to access. And as I was saying, inadequately trained practitioners could play a risky role in this. So again, a quick poll here, if you guys will hop on, and I need to go and start it up. So what I'm asking is, I know a bit of a provocative question, should psychologists be able to prescribe medications? And let's see here. Doesn't tell me. Let me see if 9 results only. Come on, there's more people on this call than that. Nobody thinks yes. That has to be impossible. Maybe not. You guys are ruining my presentation. My point was that everybody, there's a diversity of views on even these types of things. So let me also open up the next question then, which is, so this is how many hours of additional training would be adequate? There's no additional training, 100 hours of classroom, 100 hours of classroom plus clinical, 1,000, 10,000. Let's see what's happening. Okay. Interesting. That is not how I would expect things happening, but really good information. All right, let's keep moving along because I probably bit off more than I can chew. So now to be a bit more specific, this last session, there was a significant push to expand psychologist prescribing in our state. You can see in the 4 red states of Idaho, New Mexico, Iowa, and Louisiana, psychologists already have a pathway to prescribing. And it's predicted that over time, eventually this will likely roll out across the entire country. So regardless of how you feel about it, I think our role, our poll appropriately demonstrates that, you know, there are varying views on how training should occur. And my initial point was like, there are people who agree and disagree. Obviously, there's a huge selection bias within this cohort of participants in this webinar. So I'll acknowledge that. So I have to admit, you know, WSPA showed up in opposition to this bill. We had 32 members sign up to testify, which is probably a record breaker for our organization. And I want to thank everybody who volunteered to show up. And I know it was also really frustrating because I think that of the 32 people that signed up to testify, I think only 2 of us could, which was really disappointing. But I want to let you guys all know it was like not in vain. I think it really means a lot, just the number in of itself, to legislators who see these numbers and can extrapolate what it actually means. And as an example, you know, Colorado, who typically moves in similar patterns to Washington in a number of ways, a lot of similar demographics and political balance and so forth, they had a very similar bill, and it got passed in their state. So this is a demonstration where in our state it did not get passed, in Colorado it did. How you know, mobilizing our organizations can actually have a real substantial influence. I can't definitively say it was like us, but I don't think it played no role. So shifting gears to looking at substance use, there's a long, deep history associated with substance use in this country, and also an association between the criminal system and substance use, and it's fraught with a ton of social inequity that I think it's worth mentioning. And there's been a clear trend towards decriminalization, thankfully, that's very in line with substance use disorder, our understanding of substance use disorders, and in the research. And this process of legalization can take really 2 distinct pathways. And just to be clear, regardless of which pathway it takes, it's typically the exact same substance. So there's the recreational route, and then there's the medicinal route. So in the recreational route, you don't need a medical provider to prescribe. State and local agencies, they really heavily regulate and especially tax the production and sale, especially sale of these products. And as an example, in our state, these regulatory bodies impose a 37% cannabis excise tax at the time of retail sales. So that's huge. That really impacts the business model. And on top of that, the business licensing process, ironically, can be quite expensive and complicated to comply with, especially in comparison to the medicinal route. And this is regulated by the State Liquor and Cannabis Board. In the medicinal route, medical providers obviously have to prescribe for it, but you know, there's always lots of workarounds for that. And it's supposed to be hopefully for indicated reasons, but you know, again, there's a lot of soft spots there, and it really depends on practitioners to a large degree and who can do that. But I think the big points here is that often if there's a medicinal route, the product can be tax deductible. There can be no retail markup. And in some situations, there is insurance coverage possible. And the excise tax is applied at the point of manufacture. So then it gets distributed kind of all throughout the levels. So not solely on the consumer. And there are more rigorous regulations around quality and consistency with testing, which makes it safer, right? So in other words, the drug industry can really often yield a far greater profit margin through tax evasion, essentially, under the guise of medicalization. It can also lead to some misleading of the general public, who should, you know, if they have something like depression and anxiety, should hopefully seek out really evidence-based treatments for their disorders, and hopefully not turn to some of these fringe and under-investigated forms of quote treatment. But unfortunately, it almost always comes back to money. As a side note, this year, the WSPA supported House Bill 1641, which sought to levy a higher tax on high-potency THC products. I'm sure some of you guys who especially work on the inpatient unit have seen the consequences of legalization of cannabis, especially like dabbing on acute psychosis, especially in our youth. So those consequences can be seen, in what we do. But coming back to what my point is this legislative session that will be wrapping up next week. As many of you know, there was a bill to legalize psilocybin. The WSPA had largely stayed out of this debate. So in other words, not for or against, but this was under the condition that they remove any of the verbiage they had in the bill that was claiming medical indications. And specifically as a primary treatment for depression, substance use disorder. And this was according to our own experts, Dr. Sackett and Allen, who were really helpful in forming our opinion of this. And the sponsor of the bill agreed to do this, and the bill progressed along. But later in the process, these same kind of like medical indications found their way back into the bill. And it was really only through the diligence of our lobbyists who caught these changes and alerted our organization to it, and we were able to kind of draft a letter to our legislators and share our concerns, and those like medical indications got taken back out. So this is just an example of how a kind of seemingly well, it depends on your perspective, but benign bill can quickly be influenced in one way or another through an organization, and without appropriate professional help can really take a turn that might really impact what we do. And you can imagine, had we not had a lobbyist, even if we had the organization, this bill would look quite different. So another hot topic is, there was a lot of firearm bills this session. And every time there's a mass shooting, there's this familiar narrative that emerges that mental health is at the center of the debate. And if you look at public opinion, this is a very widely held belief that mass shootings occur specifically due to mental illness. But we actually know that regardless of your views on firearm legislation, there seems to be no confusion about the relationship between firearm legislation, mass shootings, and mental illness. And this is really a clear manifestation of mental health or mental illness bias. And that mental illness gets used as a distraction or a scapegoat to avoid some of the firearm access legislation. So some more details about this. So there were so many firearm bills this year. So just as a couple examples, HB 1130. So it created a path for legal liability for failure to impose reasonable controls on a sale and distribution and marketing of firearms. And we were in favor of this. And then also House Bill 1143 that creates requirements for the purchase and transfer of firearms. So it's essentially aimed at trying to keep certain individuals who shouldn't have firearms from getting them. Both of those bills we were in favor of. On the other hand, there was a bill, House Bill 1241, and this was a bill about assault weapons. So although, and in our government relations meeting, so every week we have a group of lovely individuals led out by Jen Peel and Robin Berger, and then a ton of, like you guys, members who dedicate their time to casting their vote and talking and debating about what we want to support and not. And a number of our members were really against weighing in on this and thought this is not within the purview of what we do as psychiatrists. And although I myself personally, I am in favor of gun limitations and this bill in particular, I would have personally supported, as an organization, we did not support it. And I really tell this story mostly to illustrate that there's this process within an organization that creates nuance. It enables you to have some input, and you really do have influence as to what an organization can do. And it's not so black and white, like even within the maybe more specific realm of gun legislation, there are some things we support, some things we don't, some things we're opposed to, and some things we stay out of. And there's always more nuance than it seems from the outside. And the reason I'm really saying this is that it's totally true that there's a lot of like systemic racism and structural problems that are inherent in all organizations, that's without exception. But if we abandon our organizations altogether for fear that they will like really not fully represent us, we'll ultimately lose a much larger war. And I think we need to stay focused in and actually have influence in these organizations, for the bigger picture, even if they don't always 100% represent us. But I guess what I'm saying is you have a lot of power to actually influence things more than I certainly initially thought before I started on this journey. Okay, so now for some practical strategies, looking at time real quick. Okay, 4 pretty straightforward strategies that don't really need a lot of talking about, but I'm going to do it anyways. Sorry. So being vocal. We'll talk about how to have a voice. We're going to talk about membership, our engagement with our legislators, and then lastly voting. So our voice, it is really, the political system is totally opaque. We're all very busy. The last thing any of us need is like another thing to do, especially when it comes to realms that we don't feel especially proficient in. And a lot of you guys talked about in your barriers, the initial kind of survey I took of you guys, it was like time and I feel ignorant about it. Me too, both of those things. I don't have time and I am ignorant. Yet, as we've been discussing, it's clear that we need a voice. An organization like WSPA, but really, honestly, any organization typically has a governmental relations branch to it. For us, it's our government relations committee. I already mentioned Jen and Robin, who lead that with a lot of other support. And in those weekly gatherings, we discuss the various bills that are coming up. We choose to support, oppose, or stay out of it. We get guidance from our lobbyists. And in particular cases, we try to deploy our experts, like I talked about, Dr. Sackett and Dr. Allen, who play a role. And we help educate our legislators. We drum up some of our individuals who feel especially passionate about this to provide testimony, as I've already talked about. And then we sign in these discussions. And all of these things, like if you try to imagine doing this as an individual, like I myself, pre-WSPA, like I would never be able to do any of this on my own. And truthfully, nor would really anybody else. It really requires a community. And this is the real work of a collective and an organization. It brings us, and this really brings us to like how things get done. So like, I guess what I'm making an argument for is like our only real voice, unless you are a lobbyist yourself, your best option is to work through an organization because they can do this at all these levels, and it truthfully saves us time. So I've mentioned our lobbyists a few times, so I think it's worth talking about them really briefly here. So first of all, our membership dues pay for this, and that's why I want to hit on membership dues. Obviously, we would not be able to afford lobbyists. It sounds like a scary and expensive thing, and in some ways it is. But as was noted earlier, we are either on the table or on the menu. And our lobbyists really make sure that they're at the table, as evidenced by kind of the discussion about the substance use disorder bills. And I have to admit, I used to have a very ill-conceived idea of what a lobbyist is. Like, first I thought only, billionaire oil companies have lobbyists to like push their illegitimate legislative endeavors. And it was like, you know, the man. And then I also thought, like, what kind of people are lobbyists? Like, I thought of them as these like evil people. And then lastly, like, evil people do evil things, right? So they're you know, so this was my false narrative about them. But these are our lobbyists. So the person on the right is, in red, is Katie Cullen. She is a lawyer by training, but has a passion for healthcare advocacy. And that's really her area of expertise. And her expertise in healthcare came when her father had cancer. And she was really impressed by all the work that physicians did, and said, like, this is what I want to do, is like really advocate for physicians. And she is like a passionate and really like lovely and really playful person, and we're really lucky to have her. And she last year brought on Avanti, she's the woman in blue, onto her team. And Dr. Bergquist is a child and adolescent psychiatrist by training, so she brings tons of expertise from that realm. And she was the prior government relations committee member leader. So she brings all that experience and helps us out. And she's just like a total boss. These individuals are on Capitol Hill like literally every day, especially in the legislative session, fighting for our goals. We literally could not do at all what they do. They have close personal relationships with legislators. They know who are friends and who are enemies. They know the ins and outs of the system, and they guide us strategically, knowing like what battles are worth fighting, which ones are not, when it's a lost cause, like where to put our efforts. So they're truly invaluable. And probably one of the most valuable assets our organization has. But that also comes with a really significant price tag. You know, they're not free, nor should they be. And I would argue that that price tag is far less than the value we extract from their services. Hopefully they're not listening, because then I raise their rates. But it is one of our highest costs in the organization. But this is also why membership is so important. You know, if I were just a billionaire, I'd hire these two myself to, like, you know, push this cause along. But you know, no individual, well, at least that I know of, can fund this type of thing. And this is another reason that being part of an organization is so important for like a normal person like myself, who could otherwise not do any of this work. So the team doesn't really end there, though. And, you know, we are all also part of this educational component and having an influence on our representatives. So this guy I've circled in red, this is Dr. Bergquist's husband, and he is officially a Washington State representative. And the reason I bring him up is because he was previously a primary school history teacher. So, you know, like, what do you think he knows about mental illness? Like, well, he is married to a child and adolescent psychiatrist, and, you know, maybe there's somebody in his family who had mental illness before. But, you know, my point is that the legislature is full of people like him, you know, hopefully from all walks of life, but not necessarily having any expertise in the realms of the bills that they're voting on in our interest, like mental health bills. So you have maybe a teacher and a lawyer and a plumber and who knows what voting on mental health legislation, and the only way they know which way to vote is their staff, their constituents, lobbyists like Katie and Avanti, and most importantly, you. So our representatives, and this was news to me as well, for sure, our representatives are much more interested in what we as citizens, as voters, and also as professionals have to say. Like us, they don't want to like weigh in, like, speaking of ignorance, they don't want to weigh in on something they don't know about, right? But you are the expert. You know way, way, way more than you think about how a bill will influence our profession and our patients and have an effect on the community. And being a resource to our, and I say this very lovingly because nobody can really know it all, but our ignorant politicians is one of the most important things that we can do. We can facilitate them knowing about what we do and how these bills will impact us, by telling our story of us and our patients. And unlike medicine, the wheels of politics are kind of greased with anecdotes, so it's kind of fun also in a way. We don't have to do this research that we're thinking of, because I know all you guys are thinking, I don't know enough, but the truth is you do. You know your patient's story and you know your story, and that's what legislators want to know about. They truthfully don't want to know about, and that's not what moves legislation forward, is the data. It's actually it's anecdotes. So this actually reminds me of also Jürgen's quote at the end of his email, which I often quote because I like it myself so much, that none of us is as smart as all of us. All right, so how do you do this, right? Because this is an opaque box to me. So it's actually pretty simple. And again, some disclosure and transparency. With the first time I thought about doing this, or this was proposed to me to do, I was like, no way, I don't know how to do this, and I was super scared. So I surprisingly did it anyways. So this is how you do it. So see that link there? You go to that link on the slide, and on that slide, it will have you put in your address, and it will tell you who your representatives are, and then you will click on them, and you find their email addresses, and it's usually of their staff. Sometimes it goes directly to them, which was surprising to me. And then you email them with an offer to meet, which sounds really scary. I promise it's not. Well, it is scary, but it's okay. And then you meet. And there you can ask them, like, what are you interested in? Why do you want to be our representative? Which they are really excited to tell you about. And then based on that, you can simply offer your expertise. You can tell them what you do, and you can tell them how you might be valuable to them. And doing this, well in advance without any specific agenda, they will actually use you. And more importantly, they'll know that you are their constituent and that you have interest in these areas. And then you thank them, and things continue on, so that when later, theoretically, a bill comes up that you actually have a lot of passion about, they actually already know you. They might actually even ask your opinion about it, and you can reach out to them without any kind of barriers there. And again, I realize this sounds really scary, but it is real. I have done it. It is not, they're normal people like you and I, even though it seems like they're not. They're more maybe it's a little bit disturbing how average they are, but in a good way. I've been talking a lot about doing this all at the state level, but the truth is you can do this at all levels, right? So from the institution to local levels, state and federal. This is not to say that you have to do all of them. That's really impossible, but the chain of legislation does matter. If there's a weak link at the local level, that's where the system's going to break down. So it's really important that we be involved. Like I said, we don't all have to be involved at all the levels, but think about what fits you, your personality, and where you are most passionate about. But I think if we were all touch more involved, I'm guilty of that prior to this whole journey. I think a lot can be done, and we can do a lot better for our patients. And we're actually quite lucky because in Washington State we have a great chapter of the APA. As an example, we had the greatest percentage of participation in the election of all 50 states last year. We are roughly 520 members strong, but sadly, this is just a little over half of the psychiatrists that exist in the state. So we have a lot of room to grow. And even more maybe scary is that I think the statistic that is that roughly half of our psychiatrists in the state are over 60 years old. So all of you guys, all you young whippersnappers, you certainly have a lot of job security here, but also a lot of work to do. And we're going to need to leverage, our legislative efforts to do the work that needs to be done with this growing need. These are our practical approaches, and I would like to propose that we all make a commitment to do something. And even if it's the littlest of thing, if it's just like, I am going to be a WSPA or APA member or any organization, truthfully, just being involved. I'll ask you guys to quickly make a public commitment. to this process. It can be scary. Dived in naively, but I can now say and leave this process saying, like, I came in super ignorant, definitely having no time. Really, as I was saying, idealistic and not really hopeful, but I do leave feeling equally ignorant, equally idealistic, but a lot more hopeful. I can see how even my small voice has made an impact, and I think that if mine can, certainly all of your guys can too. So let's see what people have responded, if anybody. One result, come on, representative, love it. Nice, I love it. OT and mental health. Other things, even just becoming a member, paying for our lobbyists, which are expensive but worth it. Yeah, love it. So thank you guys all. I'll let you guys. Before I stop, thank you to all these people. This is our WSPA team, our lobbyists, and in a way, we are all leaders. So I encourage you to use your voice. Here are our goals and objectives, and that's it. Thank you.
Tom, thank you very much. It's interesting, you said at the beginning, it's not your typical way of teaching, but I think I've learned a lot, and I'm confident that many others did. I can see why you've been the Supervisor of the Year for 4+ years, Educator of the Year, and so on. Thank you for walking us through this. I wonder, a couple of questions have come in, Tom. It's interesting to think about this lobbying, legislation, education relationship, which I maybe hadn't considered before, the role of education. Do you think your skill set was especially useful here as an educator? Do you want to say more about that?
Truthfully, no. I had that same delusion that, like, oh, I'm an educator, I can use these skills to really like push this agenda or make people like more clear on that. I actually think that you need no educator skill set. Stumbling through your own personal experience is totally good enough. And in my experience, legislators don't care whether or not you're using some fancy fandangled like educational strategy. I think they just want to hear your story. So yeah, good question.
Tom, here we have just a minute or two. There were a couple of related questions related to, maybe it's less about the WSPA, more about just state policy in general, specifically about involuntary treatment.
Oh.
Are you aware in the last year or maybe in the upcoming year about changes, maybe news in that area?
Yeah, there was a bill about age of consent. There's always some types of bills in that realm. And in terms of involuntary detainment, I'm not sure what to say about, yeah, if I had the answer to like how to best approach this, like one thing I can say from our organizational standpoint is like, we really rely on members who are experts in this realm, like that this is a realm that I am not a personal expert in any way. And so we go to the members who we know, and we make a call out for those people who know the most. And maybe if they're not even experts, they have a lot of passion for it, and we want to hear what people have to say. And I don't think it's unusual even for the organization to take turns in directions based on our members' opinions and what each legislation thing, because sometimes, and based on some of our lobbyists' recommendations too, because like it's a much more complex landscape than I anticipated, because sometimes our lobbyists say, oh, the sponsor of the bill is this person, and it's not going to make it anywhere, so it's not worth even talking about, right? Which is like totally beyond my scope of understanding. So there's a lot of kind of nuance in it that, what I was very naive to. But yeah, this is like the challenge with a lot of this stuff is that it all feels so big and overwhelming, and it's endless, right? Like, when will we like resolve the discussion about involuntary treatment? Like, never. And that's why we really need an organization to like keep fighting that battle. We certainly cannot do it on our own.
Speaks to the value of a, just as you said, organization, team efforts, different skill sets. Tom, I guess just as I know we're a minute over, but after the president, after your term ends, what do you do in the organization?
Yeah, good question. Yeah, so I'll be handing off to Justin Stamshore. I hope he won't embarrass me too much with his much better leadership skills. The past president, as I was talking about at the very beginning, like helps find new members who want to be involved in leadership. And, I hope to stay on and continue to help influence and, have my voice there. I will remain a member probably for my whole life. And will I be on the EC like eternally? Probably not. They'll probably eventually kick me off, but they'll have to like kick me off. Yeah, it's a really great and surprisingly like kind of normal group of people who are just really passionate, and it's great to be around them. So yeah, you stay on as past president. I don't know that there probably is an official amount of time or something, but we've had past presidents down for many times and take over committees and this and that. But there's if somebody wants to be involved in leadership and there are no like official positions available, we will create one, because we just want people to be involved. And everybody, actually, somebody just messaged me, one of the members messaged me a week ago or a couple weeks ago on a spring break, talking about wanting to start a new like kind of branch. And like, we're going to say yes to anybody who brings passion and wants to be involved. We're not going to turn anybody away. So yeah, come and be involved.
Well, very good, Tom. I thank you for presenting in Grand Rounds today. I appreciate it very much. Thank you. I think we've learned a lot about your work, about how you approach things, what you learned, the sort of ways to be involved, and more. So thank you again, and we'll end there.
Great. Thank you. Thanks everybody for coming.